Hello, my name is Dr. Sharon Crichlow and I'm a consultant dermatologist on the GMC Specialist Register. I practice at a Ventus clinic and my areas of special interest are the treatment of acne, acne scarring, rosacea, cosmetic dermatology and skin of colour. I would like to just discuss a few myths and misconceptions regarding acne. So the first is acne is caused by not cleaning the skin enough. Wrong. Often acne patients over-cleanse, to be honest, because their skin tends to be naturally oily. They tend to overcompensate by washing too frequently. There are some cases where people swear that when they have lots of sugar, when they have lots of dairy, their acne flares. And in such cases, I would say, well, absolutely avoid it or minimize it as much as possible. However, large-scale studies have not shown an association between, for instance, eliminating dairy and acne severity. And in my experience, if you have a severe case of acne, cutting out various food groups is not going to be particularly helpful and is likely to simply add to the stress levels. There is some evidence that high glycemic foods can make acne worse, and in general, obviously, we do advocate a healthy diet. Is squeezing spots the reason why we get acne scars? Well, the answer is yes and no. There's no doubt that squeezing spots can definitely exacerbate things, and if you remove the upper layers of the skin, you're more likely to produce scarring. However, there are some people who will scar anyway, and I've seen even very mild cases of acne with just a few small papules and pustules produce scarring, and so it seems that some people are prone to this particular complication. There are actually effective ways to squeeze spots which do not produce scarring, but we will come on to that later. There's the common misconception that acne is a teenage problem and everyone will simply grow out of it. While that is thankfully true for a large number of people, a significant number, and particularly women, do continue to have ongoing problems with acne well into their 20s, 30s, 40s and beyond. Some studies have shown that as many as 45% of women in their 20s still have acne, about 35% in their 30s, and in about 25% in their 40s. And it can often flare around the menopause as well.